Okay, I think what would actually be most helpful for most individuals who are undergoing fertility preservation is an explanation of what the egg or embryo cryopreservation process looks like. And that's because these are the most commonly pursued pathways for fertility preservation for patients with female body parts, and this process can be a little bit more involved. So the process itself involves three steps: preparation, retrieval, and freezing. In the preparation phase, you are self-injecting hormones for about 10 to 14 days in order to develop several eggs in your ovaries that are ready for extraction. During this time, you'll have frequent visits with your reproductive endocrinology specialist, where you'll undergo ultrasounds and lab tests to really monitor how those eggs or oocytes are developing. Then, when you're sort of at the peak moment of egg development, you'll have an additional hormone trigger shot that essentially allows these eggs to undergo their final step of maturation. Shortly after that, within about 24 hours, it has to be very exquisitely timed. You'll have an egg retrieval procedure, which is a surgical procedure where you're not usually under full anesthesia, you're awake but numbed. And a needle is inserted through the vagina into the ovaries to suction out the eggs that have been matured. After that point, you enter the third phase, which is freezing. So either the eggs by themselves will be frozen right away, or the eggs will be combined with sperm to create embryos. Those embryos will be matured for about 8 days. Oftentimes, they'll undergo some genetic testing for quality control to make sure that there are no genetic abnormalities that would prevent them from being successful in creating a pregnancy. And then they're frozen. And your oocytes or embryos, your eggs or your embryos can stay frozen like that for many, many, many years. And when you're ready to then have children in the future, they can be thawed and re-implanted either in you or in a surrogate carrier to develop into a successful pregnancy. So a quick summary of our top points today. Number one, cancer treatment can impact your fertility. Oftentimes the risks are known, but frequently, especially with modern treatments, the risks to your fertility are unknown. Your doctor should discuss fertility preservation techniques with you as soon as possible, and definitely before treatment begins. Ideally, all of these fertility preservation methodologies will take place before you get your first cancer treatment. There are many options for fertility preservation. The process usually takes 1 to 3 days for patients with male body parts and 10 to 14 days for patients with female body parts. Advocate for yourself if your doctor fails to address your fertility concerns. Especially for adult oncology providers, this is not something that they have to address with every patient. In fact, it's a minority of their patients that they have to address this. They have all had training on how to make this happen, but sometimes in that first visit, things can be quite hectic and busy as you're trying to cover a whole host of information. So if your doctor fails to bring this up, please ask the question and make sure that you are getting what you need from your provider. With that, I will close out. I'm always available for any additional questions. Thank you.